How would you react when you're told by a cashier at a mall and outlet store that he has knowledge to decide, and as per his knowledge, being a pharmacist, you don't qualify for essential care services? Or how would you react when you're told by an employee to wait in line at Costco while he confirms with other employee that being a pharmacist, do you qualify for healthcare worker priority access or not? Hey, thanks for tuning into LifeTuber today. I hope you are doing all well. It is without saying that entire healthcare community deserves a collective praise for waging the fight against global pandemic of coronavirus. What has been often overlooked, however, is the essential role that pharmacists play in providing healthcare in the time of crisis. From the earlier pandemic days, pharmacists have been working more than ever in the front lines in community pharmacies, donning whatever personal protective equipment they could find for continuous delivery of healthcare during this time of crisis. Pharmacists reconfigured their pharmacies, included plexiglass or other physical barriers to make sure and ensure uninterrupted access to medications and medical advice. They have more than ever increased the home delivery of medication. They have enabled curbside pickup to support and protect the most at risk. When medical clinic has been switching to virtual care model and have delayed appointments and other non-essential treatments, pharmacists are the one who are taking calls from patients and answering questions and giving advice. Pharmacists play a unique role in this healthcare system. Pharmacists fills gaps in the care. Pharmacists have been comforting patients suffering from pandemic anxiety, explaining the importance of dispensing limits, coping with drug shortages, and most importantly, busting the dangerous myths about fringe treatments, for example, hydroxychloroquine. You might often think that pharmacy is only a place to get medication or get medical advice, but your local pharmacist can do much more than just dispensing the medication. Pharmacists are the most accessible healthcare profession. You can just walk to the pharmacist and ask the question. You won't be able to walk to a doctor or walk to a nurse and ask your question. Pharmacists are by default the most accessible healthcare profession. Pharmacists have clinical training to help keep you and your family healthy by providing nutritional coaching, smoking cessation, public support programs like providing flu shots or even tetanus shots, other immunization. Your pharmacist can also answer you any question about medical cannabis, can get you fitted for compression stockings, provide you emergency supply or interim supply of medications under their name when you run out of refills and can't get hold of your doctor. They can provide you travel consults and travel vaccination and medication to make sure when you're on your travel you are safe. Based on the jurisdiction they are practicing in different provinces, they are provided different authority to practice. They can initiate treatments. For example, in Alberta, they can prescribe you medication. In Saskatchewan, they can prescribe you medication just for minor ailments. They can give you treatment injection of medication such as Depo-Provera, vitamin B12. In provinces like Alberta, pharmacists have been doing COVID-19 testing as well. It is coming recently to Ontario. Community pharmacists are not paid by government. They are just paid by the corporation or the small pharmacy they are working for. We don't qualify for any pandemic pay or anything that other healthcare workers qualify for. Would you be able to take a moment to think about the profession of pharmacy? Would you take a moment to think if you ever had a time when your pharmacist made a difference in your life? If so, please let me know in the comments down below. Would you agree with me that time can't be correct enough to rethink the profession of pharmacy, to provide the recognition that pharmacists deserve in the community pharmacy? If so, please let me know your thoughts down below in the comment section. And to all my fellow pharmacists, who are unseen, unheard, unrecognized, and unnoticed. I see you, I notice you, and I really appreciate you, whatever you do to make a difference in life of your patients. Brace yourself, flu shots are coming.